They're just messing with you.
It's 10 minutes to 10 o'clock, and I'm patiently waiting at the door at work for the oncoming night shift to relieve me. I can't wait to go home so I can get my homework done and go to bed, as I've had a really long day of nursing classes and I am just finishing an 8-hour shift. Tomorrow is going to be the same thing of attending more classes, and then I have to come back to work. The door finally opens, but it is not the oncoming shift, as it is my nursing supervisor that walks in. She's telling me that I'm going to get mandatoried and that I have to work the night shift. I ask her how she even thinks that's safe for somebody that's so tired to take care of all the residents. She says that I can refuse the mandatory, but then I'm going to be having the abandonment of patient care written in my file, and I have the chance of being terminated. I really wish I don't have to stay the whole night shift because I'm not going to get any sleep, but I have to get it done. Medical professionals should not work mandatory overtime. With that, I have 3 main points. 1. Mandatories cause job dissatisfaction and burnout. 2. Mandatories lead to unsafe patient practices. And 3. Mandatories negatively impact the medical professional's health. Now that I've shared my experience with being mandatory, I want to go to my first point of mandatories causing job dissatisfaction and burnout. Mandatories in the medical field are caused by the shortages of workers where there is not enough to fulfill the needs. When a person gets mandatory, they lose time to be with their friends and family. They don't have time for personal obligations, and they also lose time with sleep. With getting mandatory, it causes increased stress and emotional fatigue. According to Marcia Fowler, an RN and MSN, in 2008, in a peer-reviewed article in American Today, she talked about how the mandatories in the medical field are a vicious cycle. When an employer is looking for new employees to fill their open slots where they need workers, they fill those slots temporarily by mandatoring or forcing their workers to work overtime. These workers get burned out and they end up quitting their job, while the new workers are hired. But now that the old workers quit, there's new openings, and those new workers have to get mandatoried as they are looking for new employees. This cycle continues to continue. According to professors Douglas Salo, Linda Aiken, and researcher Amy Spinful at the University of Pennsylvania that all work in the nursing department, they conducted a study of 22,275 nurses at 557 hospitals in the states of California, New Jersey, Florida, and Pennsylvania. They learned that when a nurse worked greater than 10 hours, they are 2.5 times more likely to be burned out of their job. With this study, they found the trend that the longer a nurse worked on overtime, the more likely they would be dissatisfied with their job, want to quit, and also be burned out. This completes my first main point of mandatories causing burnout and job dissatisfaction. Leading to my second point is that mandatories cause unsafe patient practices. When an employee gets mandatoried and works a lot of overtime, they don't get a lot of sleep. This causes them not to be able to think clearly, are more forgetful, and they have poor decision making, lessened attention span, and an overall lessened job performance. With these factors, there are more chance of having medical errors, such as the nurse passing the wrong medication to a patient. With the American Nursing Association and the Department of Government Affairs in 2007, they learned that it was 3 times more likely for a nurse to make a medical error when working greater than 12.5 hours. Ann Rogers, PhD, who also wrote the book Patient Safety and Quality Evidence-Based Handbook for Nurses, found out that it's not only nurses but also other types of medical professionals that increase in error with forced overtime. They found out that critical care residents and interns that work very long hours are 35% more likely to make a medical error, such as writing the wrong medication order or ordering the wrong diagnostic study. With that, my second main point is that mandatories lead to unsafe patient practices. My third point is that And final point is that mandatories negatively impact the medical professional's health. According to Ann Rogers on the NCBI website, who also wrote the book discussed earlier, of Patient Safety and Quality Evidence-Based Handbook for Nurses, she said that it can cause health effects such as changes in the metabolism, poor appetite regulation, leading to obesity, and which can later cause diabetes. Other people have experienced symptoms such as cardiac and also have an increased chance of musculoskeletal injury. With working a lot of hours and not getting enough sleep, it affects the immune system, causing them more at risk of getting sick, having viruses, and infection. Besides those types of health effects, it also can affect the way a person drives after getting off a long day of work. With driving and working long hours, a person has slower reaction time, more drowsy, less attentive, and they are poor at making decisions. It is found that with the study, also by Anna Rogers in her book on the NCBI website, that a person that lacks 20 to 25 hours of sleep is at the same level of driving as somebody that's intoxicated of alcohol. That wraps up my third point, that mandatories negatively impact the medical professional's health. To conclude, I want to say that mandatories or forced overtime leads to burnout and job dissatisfaction, unsafe patient practices, and negatively impacts the medical professional's health. With the experience that I gave in the beginning, I have been able to experience the consequences of working long, forced hours. I was always sick. I felt like I got behind in my schooling, and I was very dissatisfied with my job and also very scared to drive home. I don't understand why mandatories are legal in the healthcare setting, as it is unsafe for both the patients and the healthcare worker. For what we can do about this, we need to inform medical facilities of the dangers and liabilities they are setting by forcing their workers to work long hours. For what we can do is we need to figure out how to fix the shortages in the medical field. So maybe if we can encourage medical facilities to have incentives for their employees, such as give them bonuses or even help with their education to fulfill the shortages, we could fix this problem. Overall, medical professionals should not work mandatory overtime for three main points. 1. Mandatories cause job dissatisfaction and burnout. 2. Mandatories lead to unsafe patient practices. And 3. Mandatories negatively impact the medical professional's health. Thank you.